Welcome back. Continuing the news. Learning from the pandemic. It's how the Health Ministry describes its plans to overhaul Jamaica's approach to public health. Speaking in Parliament on Tuesday, Health Minister Dr. Christopher Tufton listed policy changes as well as a new public-private partnership which is expected to protect the most vulnerable from COVID-19.
The global trend of COVID-19 cases and deaths had already suggested it, but Health Minister Dr. Christopher Tufton told the House of Representatives on Tuesday that an official report from the World Health Organization had now confirmed it. Lifestyle illnesses such as obesity increase the risk of severe COVID cases.
People with diabetes were up to 3 times more likely to have severe symptoms or die from COVID-19. Hypertension, cardiovascular, and diseases increase the odds for severe COVID-19 multiple times.
Mortality rates are higher among patients with cancers. Smokers had more severe cases, and alcohol consumption also reduced the body's defenses. It's why the health minister says the cabinet has decided to put renewed focus on health and wellness as a policy priority. In what he termed the overhauling of Jamaica's public health approach, the ministry will be tabling tobacco control legislation, an alcohol consumption policy, and establishing a non-communicable disease NCD task force.
Today we launched the Public-Private Partnership for Non-Communicable Program, or PPP for NCDs. Madam Speaker, this initiative will seek to maintain essential primary care services for non-COVID-19 clients with diabetes and hypertension, enabling them to access routine care through private physicians and to free up the resources of the health centers to focus on critical cases and the pandemic response.
According to the minister, over 70% of COVID deaths are persons over 60 years, while 92% of deaths are patients with one or more non-communicable disease.
The PPP for NCDs program, Madam Speaker, which is aimed at minimizing the exposure of clients with chronic illnesses to COVID-19 at the public health facilities, will initially focus on patients with diabetes and hypertension, as these remain diseases of significant concern in Jamaica.
The pilot will start in 8 health centers and 4 private practices in Clarendon, St. Anne, and Kingston and St. Andrew.
Madam Speaker, the local health center will identify the eligible members of the community, refer them to the private practitioner to continue their care. The health center, of course, will ensure that communication is maintained with the private practitioner and that the necessary protocols are in place for patients to be referred back to the public health system if the need arises.